We've brought Willow. She's a 1.5-year-old female reindeer from the Stone Zoo. And she's had an injury to her knee, and we've brought her here to take advantage of the generosity that Tufts has offered us and to provide the best quality of care to surgically repair the injury to her knee. Generally, we're very capable of performing surgeries and all manner of procedures at our hospital at the zoo, but a procedure like this requires specialized equipment that we don't have. It also requires specialized skill, and we're more than happy to take advantage of the opportunity to let a boarded orthopedic surgeon like Dr. McCarthy perform that procedure and do a much better job here than we might be able to do back at home.
The reindeer has a dislocating kneecap, and this is something that actually we see fairly frequently in small animals, so they're going to have us do it on the small animal hospital instead of the large animal surgeons. So basically the kneecap is attached, through your knee, through the quadriceps, to the kneecap, to the top of your tibia, and so we're actually going to take the attachment of the kneecap, which is too far towards the outside, and move it center, and by making a fracture, and then we're going to fix the fracture with a plate and screws. But she is very large, I think 150, 160 pounds, and so when they flex their knee, they're going to pull against the fracture that we made with incredible force. And so what we're going to do is we're going to use a plate and screws. Not only plate and screws, but there's special types of plate and screws that we have that we'd use here, and so that is just not going to be accessible pretty much in other places, so that's the idea.